Hello, please start by telling who you are and what's the name of your product.
My name is Shai Newman, and I'm from Compedia, which is an Israeli-based company. And we have many products, but we are dealing in the field of education and healthcare. And we are in the business for about 25 years.
Yeah.
And we have products that are sold all over the world and available in, I think, in 35 or 40 languages, including Dutch. We have many products, by the way, in Dutch.
Okay.
So our origin is from the education market. And in the last few years, we are more into healthcare and related technologies. All kind of technologies like that related to smart classrooms and virtual worlds and learning systems and so on.
And what's the product you're here? There's a stand here behind me.
The main focus here is a product that is called Macomba, which is for children with diabetes.
Mm-hmm.
And it was developed in cooperation with Schneider Clinics and with Intel, with the support of Intel. Intel supplied the devices, the computers to the clinical test, and some financing for the development.
Yeah.
And we supply all the systems, and we actually developed the product, which is a virtual world in which children with diabetes actually behave like in a real world, in a simulated environment. But what is interesting is they have to, if they behave in the right way, they keep the diabetes regime, their results in the virtual world, in the game is better.
Okay.
Or better. So
a way, so it gives instructions for them how to behave.
Not exactly. They have to, in a way, they are controlling an avatar.
Uh-huh.
And actually they train this avatar how to behave correctly with the avatar's diabetes. The issue is with diabetes is that there are very good solutions, like if you test yourself and know when to eat and when to inject insulin and so on,
yeah.
And then you are okay.
Yeah.
And if you are not doing it, you are not okay, and sometimes even really dangerous.
Yeah.
The issue is not the medicine, which is well known. It's actually to comply with the medical regime that you have to go through.
Yeah.
And it's especially difficult with children because there is no vacation. Day in, day out, you have to keep the regime. And the software actually helps because when the psychologist or the therapist go to the child, tell him, look, you have to do this and this and this, sometimes there is objection. Mm-hmm. Also because children are not happy with this disease, of course, so they don't like it.
No.
So in a way, by letting them handle an avatar and train someone else, there is some kind of detachment from psychological point of view, and it's actually they learn much better without rejection
and without anyone telling them what to do.
Exactly, they telling the avatar what to do.
Yeah.
And also the environment is real life simulation, so there is all the time the level of glucose. So when you move in the virtual world, when you do activity, when you play a game which is an activity game that you have to jump and so on and so on, your glucose level is going down. When you eat something, your glucose level going up. So it's a real life simulation.
Yeah, so you know what's going on without a doctor telling you, but you can you learn from playing the game.
Yes,
that's
all the time.
Good.
And also, it is connected to a glucometer. So you actually the real tests you upload to the internet. So all the data is available for the clinicians, for the doctors to monitor and see and so on.
Okay. So, who is your market? Well, children with diabetes, of course. Is that a big market?
There are a few millions of type 1 diabetes in the world. Children, I think, to the best of my understanding, is about 1 million, 2 million around the world. Not all of them are treated. So if we are talking about the OECD countries, then it's about 500,000 to 1 million, I think. This is the best numbers I have, the best statistics I have.
Yeah.
So it's a significant population. And there is the issue of the channels. Do you go directly to homes, to the parents? Do you go through clinics? Do you go through insurance company and so on?
Yeah.
So, but currently we are in the clinical test stage. It's 12 weeks clinical test, assuming that after, the assumption is that after 12 weeks, all the knowledge that you have been accumulated is lasting. The changes, the behavioral change is lasting. This is the assumption. We are now at week I think we are about in the middle of the clinical test, so we don't have yet the concrete results, but the initial results, which means the usage patterns are very promising. The average is 2-3 times a week, which is about what we have expected. And also we see from the results in the quiz, because we see what the child is doing in the virtual world, we see they're improving. We see that, for example, if there is all kind of Who Wants to Be a Millionaire style games, we see that the results are getting better. We see that the glucose level is getting better on the virtual environment. Now, the assumption is quite good, it's based on other research, on other systems, that if a patient do it in a virtual environment or learn it, then it has an impact on his real life. But this, the full impact we'll see about 2 months from now.
So why is it? Because we talked to quite a few people who had a brilliant idea for a game which could help with health issues, and there's always the process of getting it acknowledged, getting the stamp that it works. Why is that so important?
Because when you talk about clinical product, about healthcare products. Because it deals with people and with health and sometimes with life, then the threshold is higher. The environment, the system wants to see that it really works. So in a way it's good, but I'm sure there are many things that are working quite well, but they didn't go through the clinical path. But you know, this is the healthcare environment is quite regulated, and I think all in all it's quite good. But maybe in some cases it has impact.
But does it also have to do with financing the process? Because I can imagine if it is approved, if it's like a medicine, then it's easier for insurance companies to...
Exactly. So the challenge is to make it maybe not as a medicine, because you know medicine you can change. Software is ever changing every time. So I think it's more like a medical device, and it's really tricky because it's a new area, and I know the FDA just approved one software. I don't have all the details, but everyone can Google it and learn from it. I think it was approved as a drug, and this is the problem, because now they can change it without losing the approval. But I think the direction is to make it as a medical tool, and as it becomes more common and there will be more software, clinical proven software, then it will be regarded as a medical device, and then it can benefit from all the huge resources that are allocated for healthcare through insurance company and governmental. So this is where I think the industry should go. It should go toward things that can be clinically proven and then approved as a medical device or some other category that enables to get the funds, and then becoming a market. And when it's becoming a market, then it can get investment, and then you have an industry. We are not there yet. But,
no, because if you don't go that path and you just put it on the market and people can buy it themselves, for instance, would that be a possibility, or would the game be too expensive?
I think it's a possibility, but it's a much smaller market, and also many medical conditions are targeting a relatively small number of people. So it's not a mass market. By definition, and the cost of development is higher than a standard game sometimes, because you have to go through the clinical tests and so on. So in a way, there is no business model at the consumer level price points. So you must, I think, in order to have a sustainable systems and to make this industry a healthy, real industry, you must price it higher, like medical devices are priced. And then, even with lower numbers of users, it still makes sense commercially wise to develop such things. And once it's commercially wise, then you have a lot of opportunity, and then we will start to see more and more things happening in this market.
So it's in the end it's either the government or insurance companies who will pay for it.
Eventually, if we want that it will be targeting, if we want to handle conditions that are not only the most common one, and to do real good products. This is, I think, where the market is going.
What is the user response? You say you're in the middle of the trial now?
Yeah, actually, we treat it as a real game.
Yeah.
Like because if you.
So it's fun as well?
It's real fun, yes.
Yeah.
It's real fun.
Yeah.
It doesn't have the budget of what is called the AAA games. So we have to find quite creative ways in order to keep the children engaged. Mm-hmm. So we found several things, like we are doing all kind of contests and groups and all kind of things that some of them are already implemented, some of them are under development to keep the children engaged into the system. So this is a big challenge, and the feedback so far are quite good. As I said, the proof is in the pudding. If they are using it enough, and if we see the results that we can monitor very easily, like the percentage of the right answer, like the behavior of the avatar compared to a few weeks ago, and we see that there is a difference, that he remember to eat before he's doing activity, and so on and so on. And then it seems that we are on the right direction. So I'm quite, actually it will be quite surprising if it won't work.
Yeah. So when will it be on the market, do you think?
I think I think next year. And it depends, of course, on the clinical test results.
A very long process to go through. Well, it's probably with every game. That's
First of all, every game, it's a long process.
Yeah.
Unless you just do a sequel. If it's a new game, you have to, you get many surprises down the road. So, so you have to improve it. So it's a long process. Developing a game costs a lot of money. And when you do a product for healthcare, then there is also all the issues of, you have to get Helsinki approvals for the clinical tests, and then you have all kind of limitations, what you can do, what you can't do. You have to keep the control group. You have all kind of issues that you have to handle very carefully, and also it takes time, because clinical tests, they have all kind of statistically significant issues, and sometimes you have to repeat the test. So it adds to the process, and then if you come with a second version, you want again to validate it. So all in all, developing things for products, of course games, to healthcare market, it's a long process. Yeah. But we at Compedia believe that eventually this will become an industry, because it has such a tremendous cost-effective benefits, such less costly than putting, for example, a specialized psychologist to help the child, and there are all kind of things. We have a project, for example, with Cambridge University for autistic children, and now 1% of the population is diagnosed. Yeah. It's starting to be big numbers, and there is there are not enough good professionals that can handle such a quantity. And when you talk about rural areas, you rarely get some. So such a system that can, what is called telemedicine or teletraining or whatever, can really save a lot of people, a lot of children, for example, in the autistic arena, because otherwise they won't get real professional treatment.
No. Thank you very much.
Thank you.